One difference between metered-dose inhalers and DPIs is expiration dates. After opening most metered-dose inhalers, doses can be used until the original or primary expiration date on the canister. On the other hand, most DPIs have a secondary expiration date once the pouch or foil tray is opened. The diskus, twisthaler, and ellipta all have secondary expiration dates. Usually, secondary expiration dates are not a significant problem, as these devices are designed to contain a 1-month supply. But there are situations when unused doses may be left in the device for longer periods. For example, the strength is changed, the device is temporarily misplaced, or therapy can be interrupted during a hospitalization. So, it is a good habit to routinely write the expiration date on the label when opening it. The ellipta provides room on the device label for patients to do that. Devices should be discarded after the secondary expiration dates. The manufacturer recommends that the diskus should be discarded 30 days after removing it from the foil pouch. There is some data to suggest that drug particle size and uniformity may be adequate for slightly longer periods, even up to 90 days. So, there is some room for clinical judgment. The ellipta has a secondary expiration date of 6 weeks after opening the foil pouch. The manufacturer of the flexhaler does not specify a secondary expiration date, so it can be used until empty or the primary expiration date. Used in the usual dosage, the diskus, twisthaler, flexhaler, and ellipta contain a 1-month supply. The dose counters on each device make it easy to track the doses remaining and obtain refills in a timely manner. The diskus, ellipta, and twisthaler count down each dose. But the flexhaler uses intervals of 10. A patient may not notice the counter move with each dose, but one should notice movement approximately every 5 doses or so. On the diskus, the numbers turn red when 5 doses remain. On the ellipta, the left-hand side of the dose counter turns red when 10 doses remain. This is a helpful reminder to obtain a refill. It is recommended to refill the twisthaler and flexhaler when 10 doses are left. The size of numbers on the dose counter of the diskus, flexhaler, and twisthaler are small and may be difficult for some patients to read. The ellipta dose counter is considerably larger than that of the other DPIs. This is a nice feature for older patients or those with poor eyesight. If a patient is not paying attention to the counter, it is easy to continue to use the diskus, flexhaler, and ellipta devices even after they are empty. So, watching the counter is an important point to reinforce to patients. The twisthaler has an added feature. After all the doses are used, the twisthaler cap locks as a safety feature to prevent the use of an empty device. One should alert patients of this feature, however. Patients have forced off the cap or complain that device is broken because they didn't realize it was empty.